We wanted to reconvene and provide an update for the community, joined by our community partners once again. I'm just going to look behind me so I don't miss anybody. We're joined by Dr. Crode from PrimeCare Medical, Dr. Gehring, who is the Broome County Medical Director, Olivia Catalano, who is the Public Health Director for Broome County. We're joined by Todd Haskins. He is the Chief Operating Officer for PrimeCare Medical. We're joined by my good friend, a great public servant, our County Executive, Jason Garnar, my partner in all that I do under Sheriff Sam Davis, and the command staff from the Correctional Facility. Many people behind you that also played an incredibly important role in our response to this healthcare crisis. Operationally speaking, with respect to the correctional facility, we are back to business as usual. There was some discussion about limited movement, visitation, et cetera. Everything is back to normal as we meet here today. We want to provide you several medical updates, give you kind of an overall picture of where we are today versus where we were when the issue first began. To start that conversation, I'm going to ask Dr. Crode from PrimeCare Medical to come up and share some thoughts with all of you. And then if I could, I'll just ask Dr. Gehring to follow Dr. Crode in providing an update. Dr. Crode.
So I'm Dr. Crode. I'm one of the assistant corporate medical directors for PrimeCare. We were notified of what was going on early last week, and we directed all the providers here as well as the nursing staff to get in touch with the Department of Health, so that all of that started very quickly. We've had providers here up and above what we normally have here. Most of the providers came out of Pennsylvania to come up and check. I myself was here Friday morning and was here throughout the entire weekend. Right now, we're seeing some lingering symptoms, but on the overall, everything is well within the right direction. In total, from this weekend, we've done around 120 IVs. Everyone that we identified as high risk with different medical conditions was placed on antibiotics. With this weekend, when we hit the peak of what would have been the dehydration symptoms, Dr. Gehring was very helpful, and anybody that we had to send to the hospital, which we had, out of total, we had 9 admitted. I would text him, and he would walk them right through, and it has been an absolute seamless process dealing with them. But the overall is we are looking much, much better, and people are getting better.
Dr. Gehring.
Hi, Lazarus Gehring, Medical Director, Broome County Health Department. So, again, I think to put this outbreak into perspective, not to line up gold and silver and bronze medals. No one wants to be first here. But this is one of the largest foodborne Salmonella outbreaks in New York, probably since the turn of the century. There's the response here, when we kind of do the look back, was fast and appropriate. And from someone who was there, here seeing patients, at the hospital seeing patients, the coordination with the community was amazing. I'm feel incredibly fortunate for UHS, for our Office of Emergency Services, for Prime Medical, for the staff here at the jail, for the New York State Department of Health. UHS in particular provided us with the most solid supply chain of antibiotics, IV fluids, culture media to send cultures out, and their support was lightning fast. Within 15 minutes, practically, we'd have what we needed, plus a wing of Memorial 3 at Binghamton General Hospital for our Salmonella patients. These are patients you don't really want mixed in with other patients. And so I think this is something that we all need to hear. We made the county jail here into a hospital because the hospital, you can't send 320 patients to a hospital. What happens is we did this before. We did this during COVID-19. You shut the hospital down. And these patients have an infectious disease. And they're going to get care and laundry and nursing. And you're going to get spread within healthcare workers. And it burns on and on and on inside of a hospital. So keeping certain diseases away from very sick people, by definition, if you're in the hospital, you're already very sick, is the way to do public health, tried and true. And the other thing is the amount of patients we had on antibiotics and the amount of patients hospitalized. By history, we would have expected to see some mortality. And that number would be in the range of maybe 8 to 12. I mean, these are talking about people that could have died. The population of the Broome County Jail, and you look at the medical population, is very complex. Diseases such as HIV, cardiovascular diseases, joint replacements, a lot of things that you don't find in, like, so congregated in the general public, you'll find here. And that puts them at higher risk. In fact, everyone we hospitalized was a high-risk patient and had complicated medical issues. Thankfully, as of right now, there's 2 patients left in the Salmonella wing, and they should go home tomorrow. That is the hope, and they're doing better. And the care that they've got from the UHS physician staff, their nurses, the nurses' aides, the discharge coordinators, everybody there who was helping with the rooms was phenomenal. And really, according to the New York State Department of Health, this was one of the best outbreak management things you could have seen. There's a lot of questions that are just fine and criticisms that are just fine. There's a lot of things disguised that seem like logical fallacies. Like, why wouldn't you put everyone in the hospital? Why didn't you culture everybody? You can't get 320 people to give them their stool in the first place. The second thing, it's very expensive. It takes a lot of time. And you know what? It doesn't help. We had 20 out of 20 positive, like right down the line. So we usually just do 10. That would be very normal. Once you get positives, we're good. We know what we got. And we do know what we have, for sure. You'll hear more about that, and probably already know. Okay, that's my update for you.
Doc, thank you. I just want to reiterate something the doctor said. UHS is not represented here, but I would reiterate what the doctor is saying, that John Carrick and his entire team at UHS have been phenomenal partners. As you heard the doctor say today, you heard me say it last week when we met. Every single thing that we asked for, we got in very, very short order. And again, I think much of our success, to the doctor's point, is because people in all different spaces with different responsibilities came together around one another and responded to the crisis the way that the community would expect us to. Of course, prioritizing the health and well-being of the incarcerated as well as the staff. We're going to provide you, I'll ask the Director of Public Health, Olivia, to come up now. We're going to provide you an update on source testing. We're also going to provide you with an update on some of the things that we're currently doing with the food vendor that the Public Health Director can speak to a little bit more. Olivia?
Thank you. Good afternoon. So I just want to start with some basics on Salmonella, right? Salmonella infections are caused by a bacteria. People most often show symptoms within a few hours or several days after consuming either contaminated food or water or through contact with infected animals and environments. As soon as we were notified that there were 144 inmates sick, we started our emergency response at the health department. At this time, we have confirmed multiple confirmed cases and probable cases associated with this particular outbreak. The difference, as Dr. Gearing mentioned, is we can't test everybody. The confirmed are the 20 folks that we have individuals who have submitted stool samples and have tested positive. Probable cases are folks who experience symptoms consistent with the Salmonella poisoning during the outbreak period, including diarrhea, abdominal cramps, and chills. As part of this investigation, all of the samples submitted for the individuals that tested positive are now going to be compared to that chicken salad meal, which was served on Sunday, that tested positive. We need to make sure that it's exactly the same. Both of those have been PCR confirmed positive, which is a highly accurate test. Nothing else out of any of the other food that was submitted did end up testing positive through a PCR test, so we feel solid with that lunch. After completing all of the inmate interviews and having food samples set up to Wadsworth for testing and conducting our initial medical response in partnership with those mentioned before, we look to review potential factors that may have contributed to the outbreak. As a reminder, our investigation is still ongoing. We reviewed the water because, as mentioned, that could be a source, and there were no concerns found in the quality of the water. We've identified multiple violations, however, with the food preparation and the storage practices within the facility. Our team observed numerous instances in which potentially hazardous food were improperly refrigerated. Specifically, we noted milk remaining on the loading dock for more than 2 hours, refrigerated and frozen foods left on the loading dock for more than 5 hours, frozen chicken left in the middle of the kitchen for more than 3 hours before being placed into a large skillet for cooking. Multiple cases of that visibly frozen chicken were placed directly into a large skillet for cooking, and over the next several hours were attended to by the food staff. The food staff attempted to break apart that chicken while it was cooking. Following the cooking process, another critical violation was noted when food was never temperature checked. Potentially hazardous foods must be cooked to safe internal temperatures following New York State Food Code and USDA guidelines. Poultry actually needs to be cooked to 165 degrees to kill bacteria like Salmonella. After cooking, the chicken was not temperature checked. Accurate thermometers were not available or used to evaluate the potentially hazardous food, and temperatures were not checked during cooking, cooling, or reheating or holding. Instead, after the chicken was done, it was placed into a large container approximately 18 inches deep. This is another issue. It should never be in a container more than 4 inches deep. The worker was then observed handling the cooked chicken with bare hands, another violation while transferring it to the container. Food workers are required to use proper utensils or barriers to eliminate bare hand contact with ready-to-eat food. Potentially hazardous foods must also be cooled using the approved methods. So, as I mentioned, the chicken needed to be cooked to 165 degrees to clear it of that Salmonella bacteria. The food temperature should be reduced from 120 degrees to 70 within 2 hours, and from 70 to 45 within additional 4 hours. In this case, the cooked chicken was taken from the skillet where it was cooked, placed into that large container, and directly stored in the walk-in only a few minutes later. No temperatures were recorded or verified during that time, and that food sat all night in the walk-in. Food must also be protected from contamination by workers. During the meal preparation, our team observed a worker mixing ready-to-eat chicken salad with bare hands in a container so deep that the worker's arms were submerged up to his elbows in chicken salad. No hand washing or glove use was observed during this time. Food workers failed to wash their hands thoroughly after contaminating their hands as well. Additionally, we documented multiple instances where workers failed to wash their hands after handling raw chicken or eating while in the kitchen. Minor violations identified during our investigation has included so far poor hygiene and employee practices, like workers not wearing hairnets, workers eating in the food areas, improper cleaning, washing, and sanitizing of equipment and utensils. Food contact surfaces were not washed, rinsed, or even sanitized after use following potential contamination points. Sanitizer buckets were not being used during any cleaning activities. And a buffalo chopper that was used to process chicken was then used to process celery, not cleaned in between. And then the worker was observed simply rinsing it with water and putting it back together for use. Several violations noted during our investigations are actually repeat violations that we have cited the food vendor for before. Previously, those were involving the cooling of food, which is one of our main points of concern here. These similar violations were documented in June of 2024 and April of 2023. Whenever violations are identified, our staff provide education and corrective guidance to facility personnel. They also get a written report that same day or within 24 hours. Critical violations, of which we found 6 during this meal prep, must be corrected immediately and may result in the closure or pose an imminent risk to public health if not taken care of. Minor violations must be corrected within a time frame specified by the health department. Copies of our inspection and complaint investigation reports are provided to the food vendor right away. Our team also reviewed the contract with ServPro that the sheriff hired for sanitation and disinfection of the kitchen and through the entire facility. Focusing on the kitchen, where we believe that the food was contaminated, equipment was moved around throughout the kitchen to ensure proper cleaning for especially those larger machines. Racks and carts, food prep workstations, tables, and the walk-in refrigeration, including surfaces like doors, door handles, openings, and sink, were all clean and sanitized. The kitchen office, dry storage area, floor, wall hangings, dishwashing equipment, sinks were all disinfected using EPA registered materials. At this time, from the health department's perspective, we will continue to work with our partners at New York State Department of Health on additional laboratory testing to confirm if the salmonella found in those that were sick and submitted samples and the salmonella found in the food is an exact match or very close. We anticipate receiving those results next week. We will work together to continue our foodborne illness investigation, wrap up any outstanding interviews, and work closely with our partners to further identify the source or any contributing factors during this outbreak. In the meantime, we continue to provide real-time feedback to the food vendors and the administration of the county jail, and we are encouraged that all affected inmates are recovering at this time and at the county's coordinated response.
We certainly thank Olivia for her leadership and the work of her entire team that has been here, again, for the past 11 days. None of that would happen if it were not for the support of the county executive. Anytime that I call the county executive and ask for resources or assistance from one of his departments, the answer is always yes, because your county executive does what is right on behalf of the people that he represents. I am eternally grateful for that, and the people of Broome County should be as well. County Exec.
Thank you, Sheriff. I have been involved in a lot of state of emergencies where a number of county departments have been relied to be called upon to answer the call. And whether it's 4 feet snowstorms in 24 hours, or whether it's flooding or ice jams, or probably the best example of this would be COVID. It always impresses me to no end to see how every single department just puts aside everything and focuses solely on the response, and to say we're going to do everything we can do to protect lives and work around the clock to make sure that lives are protected. And I want to say to the community, this was exactly the same response that we've seen when any of those other emergencies have happened. This is a serious issue. We work together, and when I say we, it's really all the people here. I was able to observe the meetings, but to be able to see all the different departments, the sheriff, the medical teams, the health department, everybody worked together around the clock. You've seen the numbers, and to be able to come out on top of this with today standing before you, 2 people in the hospital, we expect them to get out, is nothing short of a miracle. But it was because of the hard work and the dedication of all the people working on this. And I think that's what the community wants. I think the community wants to make sure that when this happened, that everybody responded quickly and focused on one single mission, to make sure that everybody was healthy. And that happened. The second thing I think that people in the community want is they want transparency. And you've seen this. There's already been one update that was done, a public update that was done last week. Another one is happening today. What Olivia just delivered to you in terms of all those numbers and everything that happened, that's incredible transparency. And I think that's important, that the public knows what's going on, but also it's important to know just the amazing response that we were able to see. And sometimes it's hard for the public to see that because they're not inside and they're not on the meetings and they don't see the work that's being done. And I just wanted to assure people that I couldn't be prouder of every single person that worked on the response to this, to make sure that people were able to get the medical attention that they need and deserve so that they could be healthy. Thank you.
Thank you, County Executive. I think at the end of the day, right, we of course are talking about a response to the crisis as it presented, but we also want to know why and how to ensure that this never happens again. So the answers to those latter questions are happening in parallel alongside of our continued effort to ensure people are well and that they're healthy and that they are recovering. I have long said that at the end of the day, the people elected me to serve as their 58th sheriff, and the buck stops with me. I understand that. I am responsible for running this organization. And the team and I'm partial, but in my mind, we have done an exceptional job on behalf of the people for the last 3.5 years. To the county executive's point in terms of being transparent, the good, the bad, and the ugly, I stand here and I am truthful with the community. I spend the vast majority of my time chasing down frivolous accusations that all of you call me about. I'm happy to do it because I understand you have a job to do. But I would much rather focus on the truth, things that are really happening. In that vein, yesterday you all covered a press conference, and there were several accusations. I'm going to walk you through some of those. Some of you covered the fact that nobody in this jail had access to water. We only gave them a small cup of Pepto-Bismol, is what the allegation is. I would repeat something that you just heard. The water in this facility is tested, Olivia, monthly. The incarcerated population have access to clean, healthy water 24 hours a day, 7 days a week. On the waterfront, we passed out over 13,000 bottles of water over the course of the last 11 days. So Mandy's going to show you a little bit of footage of the staff bringing it into the building and then disseminating it across the facility.
Is it possible for us to get sent this video?
Sure. In addition to the 13,000 bottles of water, you can stay on the screen, whatever you like. Over 10,000 packets of electrolytes handed out by the medical staff, the jail staff. So the idea that nobody had access to electrolytes, additional waters, and we, with all due respect to the community, we take our marching orders from the medical professionals who are making determinations based on the needs of individual patients. The other thing I would say, this idea that nobody was seen, people just languished in their cells, completely untrue. Completely untrue. You heard the medical provider say, and I said it in our first press conference, the medical professionals went to every single gate and personally interacted with every single incarcerated individual in this facility. So the idea that people weren't seen, just not true. Can we go to the laundry piece? It's coming. Nobody had access to clean laundry. Everybody stayed in dirty sheets and dirty clothes. The laundry was shut down. Not true. Laundry is changed every day. By Thursday, the entire facility had been changed over in totality. Our laundry supervisor worked double shifts to ensure that laundry, understanding the severity of the situation, stayed and worked double shifts to ensure that laundry was done according to the needs of the incarcerated. Olivia talked about ServPro. The public health director talked about ServPro. ServPro came here, as I said, during our first press conference. They worked for a period of 12 hours. We talked about yesterday about dirty rags being used to wipe the floor and then wipe the tables that were being cleaned because of the outbreak. ServPro was here for 12 hours. They had nearly 30 people in the building, to the public health director's point, who not only cleaned the kitchen, but cleaned the hallways, cleaned the housing units, cleaned the common areas of the cells. We bought additional cleaning supplies, as I mentioned, the first press conference, to address the needs in the individual cells on any given day outside of the health crisis. The incarcerated population is responsible for cleaning their own room. We give them cleaning supplies. Of course, some of the incarcerated population doesn't have access to those because of their particular needs, but nonetheless, they have access to all those supplies. So, I think we have, obviously, as public servants, as elected officials, we have a duty to be transparent, to speak truth. I would beg of all of you in the press corps, you too have a responsibility to do that. Not focus on clicks, not focus on likes, but focus on disseminating truthful and factual information to the public who so desperately need that and don't want or need political grandstanding. With that, I'll take your questions. I am going to answer operational questions. I'm going to ask the medical professionals behind me to speak specifically. One other thing I want to mention, if you'd be so kind. You also reported yesterday about a young man who was refused medical attention. His mother spoke to all of you. Her name was LaToya. Todd, if I may, I'm sorry to put you on the spot. Todd saw LaToya's son personally. Legislator Kaminsky reached out to me personally and said, I had a mother contact me. She is concerned about her son. I said, Mary, I will address it. I called here and asked that her son be looked at to ensure that he was receiving proper medical care. But I'm going to ask Todd, who actually saw LaToya's son and treated him, to speak about the treatment that young man received. And I promise you, it is nothing nothing even close to what was suggested yesterday. Todd, sorry to put you on the spot.
Thanks, Sheriff. Again, my name is Todd Haskins. I'm the Chief Operating Officer for PrimeCare. Sunday, I was in the building along with Dr. Crow, Dr. Demetrio, and Christine, and the other teams from on-site here. And we did go to each unit. Anyone who wanted to be seen or be assessed, we assessed them. The assessment included what their symptoms were, how they were feeling, vital signs if indicated. We certainly looked in their mouth to see if they were dehydrated. But anyone and everyone that wanted to be seen was seen and evaluated. I'm not going to go into a specific patient. I don't want to violate HIPAA, but we did see each person. Anyone who clinically we were worried about, they were sent to the doc for evaluation, or given IVs, or sent to the hospital.
Thank you. Okay, with that, I'll take some questions.
This is more for public health and public safety, but in terms of the vendor, they've had 2 issuances of having critical issues along with having these major ones now, especially for being so unhygienic. So besides education, what's going to be done, or what's the future of working with this vendor, so individuals don't end up in this situation once again?
So all vendors are required to go through certain certifications to get a permit to serve food. There was an RFP done by the sheriff in this case and the administration for a food vendor with outlined items required around sanitation and safety and staffing and foodborne safety. On our side, for those prior illnesses that we mentioned, we have already taken them through to enforcement through them. As part of that enforcement, they chose to settle last year, and in that settlement, they pay a reduced fine, and they agree to fix their issues. As this is now multiple repeat violations, they are now going through enforcement again with the health department, and we're starting that process.
Would it be apparent to possibly think of other vendors?
So all vendors that serve food in counties are regulated typically by your health department. We do surprise inspections, so you might see the health department out in the community looking at a restaurant or responding to a complaint. So part of how we were notified in one of our other areas, we had, of course, the PrimeCare staff that reached out to us, but we also had community members calling us concerned about food poisoning coming around that same time. So we lodged our complaint investigation. So we could do a standard inspection at any time, a repeat inspection if we're concerned about what was seen earlier, and then complaint investigation. So you go to a restaurant, you see something that you think is not sanitary, or you get sick, we're going to do that investigation.
I would add to that point that as the public, I'm sure, is aware, the actions of the food service vendor wholly unacceptable, and it is not in line with what my expectations as the sheriff are. And we are having ongoing conversations with the legal department about how we will hold the food vendor accountable for the issue at hand, and then how I move forward to ensure that this never happens again. Now, does this mean I go in a different direction? It's entirely possible that that's what I'll decide at the end of the day. But we are in this position that we are in today because of the failures that have been outlined so eloquently by the medical staff and the public health officials, because of the failures of the vendor. And it is incumbent upon me as the principal to hold that vendor accountable, and I intend to do that.
Sheriff Akshar, given the company's previous record, were you surprised or shocked at what the findings revealed that may have contributed to this outbreak?
I think if you look back throughout the course of time, as Olivia spoke to, in terms of prior violations, I guess you would expect to come across those violations, minor, major. Again, if you're finding a major one, it's being corrected immediately. Would I have expected something like this to happen? No, never. You're dealing with the human element. So whether it's in law enforcement, whether it's attorneys, whether it's the press corps, people make mistakes, right? We've come to accept that, but there are some mistakes that are unforgivable, this being one of them.
Can I just get clarification that I think this is from the health director, that you outlined a number of violations and what was found in inspection. That was employees of the vendor Trinity, or were those inmate employees, or a combination of
It's a
them?
combination.
Okay. And do they all have the same training?
Yeah. Before she answers that in a little bit more detail, I just want to make sure that everyone has a very clear understanding and picture of what happens in the kitchen. The County of Broome has hired the Trinity Group to provide food services for the incarcerated population. To Olivia's point, in 2018, the County of Broome issued an RFP. Trinity happened to be one of those vendors that responded and was awarded the contract within the confines of the correctional facility to provide meals. Inside the four corners of that contract, we are required to provide them with 7 incarcerated individuals per shift to assist with food preparation, plating, cleaning, et cetera, et cetera. The entire responsibility of the folks that are assigned to that kitchen, be them Trinity employees or the incarcerated who are working in the kitchen, are the responsibility of the Trinity staff. I have a uniformed member in the kitchen every single shift to provide security for the kitchen. In the event that an incarcerated individual got into an argument or a fight with someone, a civilian staff got into an argument with an incarcerated individual, that is my responsibility within the confines of the kitchen. Do you want to expand on that?
So the only thing that I didn't mention in that area is one of the recommendations or requirements that we're making at this point is that the entire food service team will need to be retrained on food safety standards. That's part of a certification called ServSafe that some folks already had, but we now need to start kind of with a baseline and retrain everyone so that they understand all of the potential areas that we're looking at that could have allowed this Salmonella outbreak to happen.
Can I ask just like a couple more things too? Sorry.
Please.
To me?
Yeah, you were describing all these things that they were doing that was wrong. I think some are things that we wouldn't even do in our home kitchen. Sorry, that's a judgment statement. But were these observed by an inspector who was there? So they were doing these things or not doing proper things right in front of an inspector that they knew was there observing? Or was this like you were going over video and observing and then you saw that people, like
So-
how was this done? And
It's a little bit of both. Typically, when we do those kind of pop-in inspections, we're going to go through, we're going to say someone from the sheriff's team in this case and someone from the vendor, and they're going to walk through the kitchen. And when we see a violation like moldy food or dented cans, we're going to point it out because that would be one of those critical violations, and immediately that would need to be thrown away. It's still cited as a critical violation because we saw it. We take pictures, and that picture is attached to the report to show here's the evidence that we have. In the heating and cooling violations that we had noted before that we saw here again, when our inspectors come on site, they actually bring ways to test the water, thermometers to test the food. So they would walk into the walk-in and they would be able to see how long that was sitting there, that it was covered, what the temperature that it was at, and we can backtrack through video and other means to find that out.
To be abundantly clear, though, abundantly clear, the crisis in which we're talking about, the Salmonella outbreak that we've all been responding to for the last 11 days, those violations were not viewed personally by an inspector on site, by a staff member. It's been part of the investigation. So I don't want the community to think for a moment that we witnessed those. We did nothing about it. Then we served that bad chicken salad. That didn't happen. Just to be clear, I don't want anybody to misrepresent the
That's an
facts
excellent
around
point. Yeah, if we had seen this, if we were there, they would have been required to throw it away at every single one of those 6 critical violations noted with this meal. This meal would have never been served to folks. Just like if we were in our prior heating and cooling violations, they immediately had to discard that food. Typically, we saw that was sitting in the walk-in and it wasn't within the temperature that it should have been.
Okay, can we get a cut, or at least I'd like to have a copy, a written copy or PDF or something?
So they are publicly available.
Oh.
All of the food reports are publicly available. So, yeah.
I'll look at it, thanks.
With having all those critical violations, and the idea of pop-in visits, do those become more frequent after something like this, in order to keep not only the vendors but also the kitchen staff, not only alert but make sure that the process is going through correctly?
Certainly, and if we feel that someone is not being truly truthful with us during a visit, that could spur another visit, even if everything looked clean. It's kind of like when all of a sudden your boss shows up at the workplace and then everybody's doing everything correct. When we walk in as public health professionals, people are sometimes scrambling to get things cleaned up. We want the standard to always be safety so that our community feels comfortable eating in restaurants, going out to places, and knowing that our food safety guidelines established by New York State Department of Health, by the USDA, are all being followed so that we can enjoy those meals out or we can eat safely.
Last week you said that only 4 people were admitted to the hospital. Did that number go up at all?
Yeah, so as expected, we had several patients who, because of their complications, couldn't maintain their fluid status. In other words, if people are having a lot of diarrhea, like 30 times a day. And so it's hard to replace that, especially if you have underlying, for instance, kidney disease. And then when we talked last time, we were just at the height, but then what you get is this sort of more baseline chronically ill people are going to burn a little longer, I guess is a way to say it. And so that's what we saw. Actually, this went right down the line, just like Salmonella always does. Yeah, by day, by hour, even, and who gets sick. No surprise. I think we sat here and said it's going to be the complicated patient that we're going to be hospitalized, and every single one of them was exactly that, the most complicated. Yeah.
So what was the total number hospitalized?
10. Yeah, 9 or 10. And the reason I say that is because we have fluidity in our testing. For instance, one person came and tested negative the first time and then got sick on Saturday night and tested positive.
And you expect the 2 who are still hospitalized to be released tomorrow unless something else?
I hope so, yeah. They're on the mend.
Is it still possible that somebody else could be admitted because of something that was related to this, going
Indeed.
forward in the next several days?
It is possible. And for the same reasons that we said. Remember, a lot of these people were treated with antibiotics orally, and given IV fluids, but when you have that rate of depletion, sometimes that's what we need the hospital for.
Can I ask a question? Because after you talked about the 1987 outbreak,
Mhm.
I did a little digging around. So that was in a hospital. Obviously, it was 1987, a long time ago. But no one has, which is a good thing, no one has died here in Broome County.
Mhm.
But a number of people died in that, and some of them died very quickly, and they were already in a hospital. So can you talk about whether it's medicine that's changed, protocols that are changed, maybe what was different in the way that this was treated so that
Sure.
at least
It's a great
today,
question.
no one's died?
Totally logical, right? I mean, they're in a hospital already. So there's IV fluids, there's staff, but even in an outbreak within a hospital, you're going to get overwhelmed. And so we know a lot more than we did in 1987 about, precautions. The antibiotics are certainly different. Our main antibiotic was not used in 1987. It didn't exist. And that would be ceftriaxone. That's not that's a medicine that came to the fore in the 90s, really.
Is there
So-
also a protocol for how salmonella in confined spaces, like a jail or a hospital?
Or a hospital. I mean, that was from
Does
raw.
that
That was
change?
from eggs in that one. So
Yeah, that was-
yeah, and that's all. You mentioned we don't do this in our own kitchen because we're not serving like 450 meals usually from our home kitchen and don't have the responsibility. Like the stuff you do at home, like you're probably thinking it's a miracle that we're all not having salmonella all the time because salmonella is a given on chicken. By the way, that's why no culture I know eats raw chicken. You can eat raw fish, you can eat other things, but raw chicken, I don't know, because it has salmonella. So those are, we've learned a lot. Medicine is always progressing by failure, by the way. That's how we get there, right?
And you feel like you're safe now, you're past the point where people are at risk and there's a likelihood. You said some people were in situations.
Some
where
people were
they could have-
very
They
sick.
were very sick. and
Indeed.
They could have,
Mhm.
but they didn't. But you feel like everyone's clear of that phase, like that point at this point.
Almost, ma'am. Would never stop praying, or I don't want it, So I got to keep that one realistic eye open. No, we're still here. So we accomplished something great, and actually that's the easy part. It's persisting in greatness is the hard part when your staff starts to go down or people get fatigued and you don't have backup. And that's actually what we don't really have now, thankfully. We still are robust. But persisting in something that was good is actually the name of the game here. So no, I won't rest probably about this for 2 weeks.
So in your view, as a health professional, in your view, the crisis is not over yet?
Well, here, the food's gone. That's done. People can't get it. At this point, it's not going to be easy to get this from another person. So that part of it's gone. The people who are sick or in the hospital are well taken care of. Is it gone? Usually we wait like 2 full incubation periods. And then we could say it's gone. We're coming up on that. And then I'll give a little extra worry because I'm a dad. With that.
Can you speak to just, if you'd be so
Yeah,
kind,
I
you want
will
to
say
get
we-
crisis coordination and how you implement that from a PrimeCare Medical perspective?
So just to go with what's going on there, we have not set back because things look like they're getting better. We are still doing cell by cell. The nursing staff, when they're on their med pass, they know that if somebody doesn't come get their meds, they are to go to their cell and check on them. All of the guards are aware that when the nurses come on the floor, they're supposed to let them know if there's anybody they're concerned about. We've had providers here every single day that to follow this, but we have not stopped doing what we've been doing since the beginning.
So it sounds like
Okay,
it's a
thanks.
heightened state of vigilance, given what you've
Yes, what we were expecting, the worst part of dehydration to happen this weekend, which it did while I was here. But we're still dealing with some people that have lingering symptoms, which we have a list that we pass every day on who we need to see and who we're following closely. So that is still going to be ongoing for a while.
I want to speak a little bit to the response too. You had specifically asked if the response is different here. So I think the ability to communicate was a big piece here. Right away, PrimeCare staff were like, something seems off. They were able to go out and get medicine. They were able to treat the inmates. They already had a protocol in their policies and procedures to contact the health department. The health department, we are constantly prepared and vigilant and practicing things so that in the event of an emergency, we have all of these things to fall back on. We have staff, we're ready. That's the importance of qualified professionals in these roles. That's the importance of coordinated communication. If we were a day different in our response, we would have had far sicker patients to deal with. We would have had more food distributed out in the facility. So the rapid response, the communication, the qualified professionals, and that history that we have is incredibly important to why we're able to stand here today and have such good outcomes.
You think that would have happened, that kind of coordination, if not for the kind of coordination you had to do because of COVID-19?
I think we learn a lot all the time. We're constantly evolving, which is important, but that's the coordination of being public service, of being professionals, making sure that we're caring for others first, and making sure that we're following the best standards at that time.
I don't want to, I have two other questions, but I think other people have.
I think that's why it's important, to the county executive's point, you have by some this performative outrage, right? This circus that people create with false narratives. And to the county executive's point, to Olivia's point, you have a group, and so many of them are not standing here at this podium today. A group of such dedicated healthcare professionals, public safety officials, right, who don't give a tinker's damn about one's politics. What they care about is addressing the needs of the people. And you saw that here, all while balancing that performative outrage by some. The question was what?
I don't know, you'll tell me who this is for. One of the things that came out of the press conference that you mentioned, that we were all at yesterday, was one of the things I was hearing was just that there came to be a distrust of the food, because the food was what caused people to get sick, so then they weren't trusting that the food they were getting, and so they were using commissary counts or only using vending machines. And I wonder if people working, so maybe this is a question for the people who are working in the facility, but like if you're doing anything to try to help people that are there to be more trustful, and understand that you're doing things to make sure that the food they're getting now isn't the same and that it's not,
Yeah, I think it's a very fair and accurate point. I mean, the only thing I can tell you are the things that happened, right? So when the crisis was upon us, the first way we communicated with the incarcerated population was via word of mouth, right? Either through our staff or through the medical professionals. And then when we knew it was a confirmed case of Salmonella, and that was what was causing the problem, we put out a facility-wide message, an educational message to the incarcerated population. And they are required, when they turn their tablets on, they have to read that message prior to being able to access a movie or make a phone call or whatever it was. And I know that there was some criticism yesterday by some that I didn't speak enough directly to the incarcerated population. But with all due respect, I have a very, very big staff here and was managing a very, very large crisis. My time is better spent, and I mean no disrespect by this. My time in the moment of crisis is better spent, and I am better served to work alongside the medical professionals, ensuring that from an operational perspective or the perspective of the Office of the Sheriff, that I am giving the medical professionals everything that they need to keep people alive, healthy, and well.
And I will say, as soon as we identified the source of Salmonella, we immediately let the team know that food could no longer be served. So other food had to be brought into the facility to feed to the inmates. So that batch of potential, yes.
I guess that's what I'm saying. It's like, trust is a feeling. Trust isn't like a quantifiable thing, but.
When we were talking with them, when we were here with OES and with our staff and PrimeCare, in addition to those messages, we were talking to them while the health department was here doing interviews, while we were here doing care for folks. So in addition to those messages that went out, in addition to that food being stopped serving, we were having conversations saying, do you know that this is confirmed Salmonella? This is why we're asking these questions. This is why we're trying to get this information.
And the staff, as Olivia was answering, I just asked the lieutenant, the staff was articulating that as well to the incarcerated population, that it was because of this. We've stopped serving all of that food, and we are requiring the food vendor to outsource a new shipment of, or make sure a new shipment of food is inbound, and that's what we're serving.
Right. And then, sorry, just one last one. I'm not sure who of medical staff or jail staff maybe should answer this, but the other thing that came up yesterday was people saying that that when they were released, like they might have been released last Tuesday or this Monday or Tuesday, and they still were having a few symptoms, but they weren't given instructions on follow-up or what to do, or if they should do anything different or special.
Just from a PrimeCare, can anybody, or
Somebody
just a
or,
medical?
is that even necessary? So, yeah.
The difficult part is a lot of times we, as medical, even at the jail that I'm over down in Pennsylvania, we have no idea when they're leaving. So sometimes they leave before we even have a chance to talk to anybody. So, but the ones that I have been seeing, I have been talking to. Going back to your food, I've been talking to them all about the food. There's one individual who, because of how sick they were, had a heart attack, and then they come back, and they're definitely not going to want to eat the food, understandably, but having that discussion, I've had that with most of the patients. But when we are seeing them, we're talking about the symptoms, how long they're supposed to be going on, what the treatments are. So as far as the following up, there isn't anything arranged-wise, but it would be with whoever the regular doc would be.
Could you speak, though, somebody just to internal protocol in the event that someone was severely ill and was due to be released, what process we would go through in terms of ensuring that incarcerated individual had what they needed?
Yeah,
to be
if they
successful?
were severely ill and we had them on antibiotics or the medications, they would leave with the number of days that they needed left to take that. So we don't leave them without anything.
So there's a difference between severely ill, you're on antibiotics, you might have been in the hospital.
Yeah,
But every patient that we did IV fluids on, we gave them a lot of education about increasing their fluid intake. We also gave them individual packets of, it's equivalent to Gatorade, for them to have and to drink more water. I can tell you, the sheriff, I don't think is taking enough credit. He and the major were in on Sunday when we were doing IVs, and we made a request, and literally that afternoon it was occurring. So any moves or pivots that were required occurred rapidly, but we did educate every single person that we put IVs in on the importance of drinking more.
Okay.
even the ones that we were seeing at the cells.
I have just one thing.
Also the ones we were seeing at the cells.
Correct.
Okay.
Also, some of those who were discharged from here did end up seeking medical care and getting cultures, so we get those results. Another thing about 1987, ma'am, is that they couldn't test fast. We can get a test back if we're really rolling in 2.5 hours. And that's huge for all outbreaks. The other thing is what you should know about Broome County is we are big enough to have every bad disease, and we do. We have the highest percentage of hepatitis C in the state of New York, percentage-wise. We had a CDC alert HIV cluster in this county. That was the first time we ever saw HIV pass from Broome County resident to Broome County resident. That was impressive. We've had the only New York State real live Ebola drill with blood. That was a nightmare, and that was a couple years ago. So here we are with our 2 highways, university, 3 hospitals, a community college, all ringed by cows and 200,000 people. We can foment disease in this county, and the idea is that we're going to be prepared for it. So this is your county. Yeah.
Thanks, Doc. Anybody else? No? All right. Thank you.
Okay, thank you.